Hi, I'm Lauren,
And I'm Danielle.
and today we're going to be presenting on the effects of moist hot packs on chronic pain and sensory threshold.
The authors of this study hypothesized that geriatric patients with chronic pain who receive moist hot pack application to affected areas will demonstrate a decrease in pain levels and an increase in sensory threshold when compared to those who did not receive moist hot pack application throughout their treatment. So likewise, the aim of the study was to determine the effects of hot pack therapy on chronic pain and sensory threshold in geriatric patients.
This was a single-group, non-randomized study. There was no true control group, so results were compared to subjects at baseline measurements. The study design is a one-group pre-test, post-test design because measurements were taken at baseline and after the treatment. The article provides level 3 evidence because of the lack of true control, the small sample size, and the lack of randomization. The sample size consisted of 74 patients. 45 were women and 29 were men. 3 areas of the body were assessed, including lower back, knee, and shoulder. A majority of the subjects were being treated for chronic pain in the lower back region. The treatment intervention consisted of one 30-minute session that included the application of a moist heat pack to the affected area.
4 outcome measures were used in this study, 3 to assess pain and 1 to assess sensory threshold. So the pain assessments were administered prior to the treatment, immediately after treatment, and then 1, 3, 6, 12, and 24 hours post-treatment. So these assessments included the visual analog scale, the FACES pain rating scale, and the Iowa pain thermometer. An electric stimulator was used to assess the sensory threshold prior to treatment, immediately after treatment, and then 1 hour and 24 hours post-treatment. So the electric stimulator was placed on the affected area in order to introduce a stimulus. The threshold was documented when the subject first noticed the stimulation without any pain. The assessment was measured 3 times at each administration time period. All of these assessments are subjective measures that can vary from subject to subject.
One strength of this study is that it fills some gaps in research. There is a lack of research on the efficacy of the use of moist hot packs and the changes that it has on pain and sensory threshold in regards to chronic pain treatment. Another strength is that the study looks at multiple areas of the body that are frequently affected by chronic pain. Next, the researchers were able to track progression of therapeutic effects by taking multiple measurements before and after treatment. The last strength of the study is that it looks solely at the use of moist hot packs. This is beneficial because many studies look at moist hot packs in conjunction with other treatment methods. This allows the researchers to isolate the efficacy of moist hot packs within this population. One major limitation of this study is the lack of a true control group. This limits the researchers' ability to compare the study results to another untreated population. Including a control group would increase the level of evidence that this article provides, as well as make the study results more reliable and valid. Another limitation was the short treatment duration. The hot pack was only given throughout one treatment session rather than over a prolonged period of time. Even though assessment measurements were documented multiple times, the effects cannot be considered long-term. The small sample size was another limitation of this study. The authors are unable to generalize the results to a larger population. Lastly, even though multiple regions were being treated, there was a lack of variation in the location in that most subjects were being treated for low back pain.
The results of this study showed a decrease in pain and an increase in sensory threshold immediately after application of a moist hot pack. This study is applicable to our future practice in that it supports the use of moist hot packs as a treatment method for chronic pain. It can be used as a successful preparatory treatment method in order to help clients engage in more purposeful and beneficial treatment sessions. This could also be beneficial to our clients in more long-term care. However, more research needs to be done. Moist hot packs are a useful modality for clients in the clinic as well as at home. Therefore, this article allows us to apply the study results in order to implement a valuable home exercise program for our clients to succeed outside the clinic. Overall, this study provides evidence that supports the treatment for chronic pain in the geriatric population. However, more research needs to be done in order to be able to generalize these results to a larger population and other diagnoses.
Here is our reference page, and thank you for listening.